Hello, everyone, and welcome to HRS Presents. I'm your host, Reggie Robinson. July is Bebe Campbell National Minority Health Awareness Month, a time to focus on the unique strengths and challenges that Black, Indigenous, and people of color, or BIPOC, face when it comes to their mental health. Bebe Campbell was a journalist, teacher, author, and dedicated mental health advocate for the Black community and other underrepresented groups. National Minority Mental Health Awareness Month was established and named in honor of her work. Her ability to tell impactful stories highlighting the themes of racism, mental health, and family left a lasting mark on this world and is a foundation for much of the work that continues in support of Black, Indigenous, and people of color mental health. Formally recognized in 2008, Minority Mental Health Month has two goals. 1. Improve access to mental and physical health treatment and services and promote public awareness. And 2. Enhance public awareness of mental and physical illness among minorities. Culture, ethnicity, and race all play a role in the way that each person experiences the world. These factors, among others, have profound effects on mental health, especially for Black, Indigenous, and people of color. Chronic illness like heart disease, type 2 diabetes, hypertension, and obesity impact a disproportionately high number of minorities. There are many factors that contribute to this disparity, including culture, income, education, genetics, access to care, and communication barriers. These disparities are often influenced by social determinants of health, such as environmental factors and access to health care rather than biological differences. For instance, higher rates of asthma are more commonly found in minority populations living in areas with poor air quality, highlighting the role of environmental influences on health outcomes. A person's social, religious, language, or cultural practices may also influence the way they use health services. Some of these disparities include the following. According to the American Heart Association, African Americans have a 33% higher death rate from cardiovascular disease than any other group. African Americans are twice as likely to have a stroke. Native Americans are much more likely to die early from heart disease. 36% will die of heart disease before the age of 65, as opposed to 17% of the overall U.S. population. Mexican Americans, African Americans, Native Americans, and Alaskan Natives have a much higher prevalence of type 2 diabetes than other groups. African American and Mexican American women have a much higher rate of obesity than Caucasian women. African Americans are 60% more likely to be diagnosed with diabetes than non-Hispanic whites, and they also have a higher risk of hypertension, with nearly 40% of African American adults affected. According to the CDC, 27.5% of African Americans and 23.4% of Hispanics in the U.S. report not having a usual source of health care, compared to 16.6% of non-Hispanic whites. People in low-income neighborhoods, which often have higher proportions of minority populations, are 2 to 3 times more likely to live in food deserts, limiting access to nutritious food. And a study found that 70% of Black Americans live in areas that exceed the Environmental Protection Agency's limits for air pollution, contributing to higher rates of respiratory illnesses like asthma. So what can we do about these alarming statistics? Besides raising awareness and getting this message out to all of our communities, here are 5 steps to preventative care which can reduce the risk of having a heart attack or stroke. Number 1, reduce bad foods. Choose foods that have no or low levels of saturated fat, trans fat, and sodium. Saturated and trans fats are in fatty beef, pork, poultry with skin, lard, butter, and dairy products made with whole milk. Sodium comes from the amount of salt in your food. 2. Eat heart-healthy foods. Cook with fresh vegetables, fresh fruit, whole grains, fish, nuts, and seeds. Eat the leanest cuts of meat you can find, or have meals without meat. Drink beverages without added sugar. 3. Stay physically active. Try to get at least 150 minutes of moderate physical activity, such as a brisk walk, or 75 minutes of intense physical activity, such as jogging or running, every week. 4. Strengthen your muscles. Do muscle strengthening exercises that work all major muscle groups at least 2 days a week. This includes back muscles, legs, hips, chest, shoulders, and arms. And 5. Quit unhealthy habits. Stop smoking and abstain from or limit alcohol use. It's also important to recognize the need to maintain mental health. You can do a quick online mental health self-check at mhascreening.org. In addition, please remember that local resources are available to help. Health Recovery Services has been a trusted community behavioral health care resource for 50 years. You can contact us for assistance in your mental health journey. Our website is www.hrs.org, or you can call us at 740-592-6720. Our outpatient treatment sites across southeastern Ohio offer highly qualified professionals with expertise in behavioral health treatment, including substance use disorders. And our residential centers, Bassett House, and the Rural Women's Recovery Program have consistently been recognized for excellence. I leave you with a 2005 quote from Bebe Campbell. Once my loved ones accepted the diagnosis, healing began for the entire family, but it took too long. It took years. Can't we as a nation begin to speed up that process? We need a national campaign to destigmatize mental illness, especially one targeted toward African Americans. It's not shameful to have a mental illness. Get treatment. Recovery is possible. Thank you so much for watching. Please follow us on Facebook and subscribe to our YouTube channel. We'll see you next month on HRS Presents.